Question 1. Fundamental veterinary surgery concepts. Which of the following is the most critical aspect to maintain during a surgery in order to prevent postoperative wound infections? A. Choosing the right surgical drapes for the procedure. B. Maintaining strict aseptic techniques in both preparation and surgery. C. Using high doses of antibiotics immediately before surgery. D. Selecting the appropriate anesthesia agent to minimize stress. Answer: B. Maintaining strict aseptic techniques in both preparation and surgery. Explanation: maintaining strict aseptic techniques throughout the surgical process, from preparation through to closure, is the most crucial factor in preventing postoperative wound infections. Aseptic techniques involve practices such as proper sterilization of instruments, wearing sterile gloves and attire, draping the patient adequately, and ensuring the surgical field is maintained sterile. Without these measures, the risk of introducing pathogens into the surgical site increases dramatically, leading to infections, wound complications, and delays in recovery. While antibiotic prophylaxis option C can help reduce infection risk, it should be considered an adjunct, not the primary line of defense. Surgical drapes option A are essential but insufficient without the proper aseptic practices, and anesthesia option D minimum stress but does not directly contribute to infection control. Question 2. Anesthesia and analgesia. The veterinary surgeon is preparing to perform abdominal surgery on a dog. After pre-anesthetic assessment, they decide to administer both an intravenous anesthetic and an inhalant anesthetic. Why is this approach beneficial in this case? It reduces the overall cost of anesthesia while maintaining a high level of sedation. B. Minimizes the risk of bradycardia during the procedure by ensuring stable cardiovascular function. C. It allows for faster induction of anesthesia and more precise control of the anesthetic depth during surgery. D. It ensures that the patient will be awake during the surgery and only sedated. Answer: C. It allows for faster induction of anesthesia and more precise control of the anesthetic depth during surgery. Explanation: using both intravenous Roman anesthetics and inhalant anesthetics together is a common practice to achieve rapid induction and precise control of anesthesia. Roman agents, such as propofol, induce anesthesia quickly, providing the surgeon with the ability to rapidly sedate the patient for intubation. Once the patient intubated, inhalant anesthetics like isoflurane or sevoflurane are administered to maintain anesthesia a controlled depth throughout the procedure. This dual approach provides both fast induction and fine-tuned maintenance of anesthesia. Option is incorrect, as the goal isn't to reduce costs but to optimize anesthesia. While inhalant anesthetics can help minimize bradycardia, option B, they are primarily used for depth control. Option D is incorrect, as the combination of these agents ensures the patient is under general anesthesia, not awake. Question 3. Postoperative care and complications. Scenario-based. Mr. Thompson has brought his dog Max to the clinic for surgery to repair a femur fracture. The surgery went well and Max has been sent home with an e-collar to prevent licking the incision site. 2 days after surgery, Mr. Thompson notices that Max is excessively licking the wound area and the incision appears slightly red and swollen. What should Mr. Thompson do first? A. Continue monitoring the wound at home and apply antibiotic ointment. B. Immediately schedule a follow-up appointment with the surgeon to have the wound assessed. C. Allow Max to lick the wound for a few more days, as it may help the healing process. D. Give Max an additional dose of pain medication and wait for the redness to subside. Answer: B. Immediately schedule a follow-up appointment with the surgeon to have the wound assessed. Explanation: in this scenario, excessive licking and signs of redness and swelling around the incision site indicate that the wound may be infected or could be at risk of infection. Mr. Thompson should not attempt to manage the situation solely at home, but should seek professional evaluation to ensure proper wound care and prevent further complications. The surgeon assess whether the incision has become infected, determine if further intervention such as antibiotics or wound debridement is needed, and check whether the e-collar needs adjustment or replacement. Option is not the correct approach, as home management without professional evaluation could delay appropriate treatment. Option C is dangerous, as licking can introduce bacteria into the wound, leading to infection. Option D is also incorrect, as simply giving more pain medication without addressing the underlying issue will not resolve the potential infection and could mask important clinical signs. Question 4. Surgical procedures. Soft tissue surgery. Which of the following techniques is most commonly used to minimize tension during soft tissue closure? In a large abdominal incision, A. Simple interrupted sutures placed at regular intervals. B. Tension relieving sutures or mesh reinforcement. C. Subcutaneous fat suturing to reduce dead space. D. Continuous suture technique with minimal tension applied. Answer: B. Tension relieving sutures or mesh reinforcement. Explanation: in soft tissue surgery, especially with large incisions, tension on the wound edges is a critical concern as it can lead to wound dehiscence or poor healing. Tension relieving sutures, such as horizontal mattress sutures or mesh reinforcement, are employed to distribute the tension more evenly across the wound and reduce the risk of complications. This technique is especially used for larger wounds, such as those found in abdominal surgery. Option: and may not adequately address tension and larger incisions and could increase the risk of wound complications. Option C is often used to prevent seromas or hematomas but does not directly address wound tension. Option D, while useful in some situations, can still leave some tension on the wound edges if not carefully managed. Question 5. Diagnostic imaging and surgical planning when performing a preoperative evaluation for a patient requiring abdominal surgery. Which of the following imaging modalities is most helpful for assessing the size and location of a mass suspected to be affecting the gastrointestinal tract? A. X-ray, specifically a contrast study using barium. B. Ultrasound to assess soft tissue masses and fluid accumulation. C. MRI to visualize tissue differentiation in soft organs. D. CT scan to assess for both the location and extent of the mass in 3D. Answer: D. CT scan to assess for both the location and extent of the mass in 3D. Explanation: A. Computed tomography provides detailed 3D imaging, making it ideal for visualizing the location, size, and extent of soft tissue masses within the abdominal cavity. It also allows for clear differentiation between various types of tissue, which is essential in planning surgery. This modality is especially helpful when evaluating or other abnormalities in the gastrointestinal tract. Option A, X-ray, may show general abnormalities, but it lacks the specificity needed for assessing soft tissue masses and does not provide the level of detail offered by CT scans. Ultrasound, option B, is effective for identifying fluid accumulation and assessing soft tissues, but does not provide the same resolution and spatial orientation as a MRI. Option C is more commonly used for neurological and musculoskeletal imaging rather than for abdominal mass evaluation. Question 6. Anesthesia and analgesia. Which of the following best describes the principle of multimodal analgesia in veterinary surgery? A. The use of opioids exclusively to provide pain relief before, during, and after surgery. B. Combining multiple analgesic agents with different mechanisms of action to achieve superior pain control. C. Relying on local anesthesia alone for all surgical procedures. D. Using sedatives and tranquilizers to control pain during surgery. Answer: B. Combining multiple analgesic agents with different mechanisms of action to achieve superior pain control. Explanation: multimodal analgesia involves using a combination of drugs or techniques that target different pathways of pain, providing superior pain relief and reducing the risk of side effects associated with high doses of a single drug. For example, a combination of local anesthetics, NSAIDs, opioids, and anesthesia can be used to target various pain mechanisms, including peripheral, central, and inflammatory processes. This approach results in more effective pain management and quicker recovery. Option: the focus is too narrowly on opioids, which, while effective, do not target all pain mechanisms. Option C is incorrect because local anesthesia alone is not sufficient for all types of surgery. Option D focuses on sedation, which helps manage anxiety but does not adequately address pain. Question 7. Emergency and trauma surgery. Scenario-based. Dr. Williams is called in to perform emergency surgery on a dog that has been hit by a car. The dog is in shock and has severe abdominal trauma, including signs of peritonitis. What is the first priority for Dr. Williams before performing the surgery? A. Administering a high dose of antibiotics to prevent infection. B. Stabilizing the dog's cardiovascular and respiratory status. C. Preparing the abdominal cavity for surgery by sterilizing the area. D. Immediately performing an exploratory laparotomy to assess damage. Answer: B. Stabilizing the dog's cardiovascular and respiratory status. Explanation. In trauma cases, the first priority is to stabilize the patient's cardiovascular and respiratory status before proceeding with any surgical intervention. Shock, especially from severe abdominal trauma, can lead to hypotension, inadequate perfusion, and respiratory compromise, all of which need to be addressed immediately. Stabilizing these vital signs ensures the patient can tolerate anesthesia and surgery. Option A, while important, should follow stabilization. Administering antibiotics, option A, is critical but comes after initial stabilization. Option C is premature because the patient's vital signs must first be stabilized and sterilizing the abdominal cavity. Option C is part of the surgical preparation but must be done once the patient is stable. Option D, though essential, cannot proceed until the patient is sufficiently stabilized to handle the trauma of surgery. Question 8. Postoperative care and complications. Which of the following is the most effective strategy for preventing surgical site infections (ESIS) during the postoperative period? A. Aggressive wound cleaning and debridement immediately after surgery. B. The use of sterile bandages and proper dressing changes, along with timely administration of antibiotics. C. Leaving the wound uncovered to allow for air circulation. D. Encouraging the pet to engage in normal activity shortly after surgery to promote healing. Answer. B. The use of sterile bandages and proper dressing changes, along with timely administration of antibiotics. Explanation. Postoperative wound care is essential in preventing surgical site infections. Properly dressing the wound with sterile bandages, along with timely administration of antibiotics, helps prevent contamination and infection. Additionally, changing the bandages as recommended ensures that the wound remains protected and clean. Especially important in high-risk surgical cases or where contamination could lead to severe complications. Option. It could cause further trauma to the wound and delay healing, while option C is not recommended as moisture and dirt can introduce bacteria. Option D could lead to complications, as early movement may stress the surgical site and delay healing. Question 9. Surgical pathology. Which of the following is a critical factor to consider when handling tissue samples for histopathological assessment in veterinary surgery? A. Ensuring that tissue samples are kept at room temperature during transport. B. Fixing the tissue samples promptly in formalin to preserve cellular structure. C. Only sampling superficial tissues to minimize the risk of contamination. D. Storing tissue samples in an anaerobic environment for improved results. Answer. B. Fixing the tissue samples promptly in formalin to preserve cellular structure. Explanation. Prompt fixation of tissue samples in formalin is crucial for preserving the cellular structure and preventing degradation of the tissue. Formalin helps maintain the integrity of the sample, allowing for accurate histopathological evaluation. Delays in fixation can lead to tissue decomposition, compromising the diagnostic quality of the sample. Option is incorrect because room temperature can cause rapid tissue degradation. Option C is inappropriate as sampling only superficial tissues may lead to incomplete diagnosis. Option D is not generally recommended as anaerobic conditions are unnecessary for most routine histopathological processing. Question 10. Advanced surgical techniques. Robotics. Which of the following is a primary advantage of robotic-assisted surgery in veterinary practice? A. Reduced cost of surgical procedures for clients. B. Improved precision and control in complex procedures. C. Elimination of the need for anesthesia during surgery. D. Increased surgical complication rates due to the complexity of the equipment. Answer. B. Improved precision and control in complex procedures. Explanation. Robotic-assisted surgery offers enhanced precision and control, especially in complex surgeries, due to the advanced instrumentation that allows for fine, detailed movements. The surgeon can operate with greater accuracy, which is particularly beneficial in delicate procedures like orthopedic or microsurgery. Robotic systems also allow for better visualization and reduce the physical strain on the surgeon. Option is incorrect because robotic surgery tends to increase costs due to the need for specialized equipment. Option C is incorrect because anesthesia is still required. Option D is inaccurate. While there is a learning curve, robotic surgery tends to reduce complications by offering better control and visualization. Question 11. Surgical procedures. Orthopedic surgery. Which of the following techniques is commonly used to stabilize a comminuted fracture of the femur in a dog with the goal of minimizing complications during the healing process? A. Use of external fixation with pins and bars to stabilize the bone. B. Insertion of a plate and screws to directly align the bone fragments. C. Bone cement injection into the fracture site to promote healing. D. Mobilization using a cast to prevent movement at the fracture site. Answer: B. Insertion of a plate and screws to directly align the bone fragments. Explanation: for a comminuted fracture where the bone is broken into multiple pieces, one of the most effective stabilization methods is the use of an internal fixation device such as a plate and screws. This technique helps directly align the bone fragments and maintain their position during the healing process, reducing the risk of complications such as malunion and non-union. The plate and screws provide strong, stable fixation that allows for early mobilization and improved bone healing. Option A. External fixation is typically used in less stable fractures or when internal fixation is not feasible but may be more prone to infection or complications in some cases. Option C. Bone cement is not commonly used in the stabilization of fractures but may be used in certain orthopedic procedures like vertebroplasty. Option D. Using a cast is appropriate for certain fractures but would not provide sufficient stabilization for comminuted fractures. Question 12. Anesthesia and analgesia. Scenario-based. Dr. Taylor is preparing to perform a routine spay on a 5-year-old cat. During the pre-anesthetic assessment, the cat's heart rate is found to be elevated and the cat shows signs of anxiety. Which of the following should Dr. Taylor do next to ensure safe anesthesia and recovery? A. Administer pre-anesthetic sedatives to calm the cat and stabilize its heart rate. B. Proceed with the surgery as planned since anxiety is common and manageable. C. Discontinue the procedure and refer the cat for more thorough cardiac evaluation. D. Delay the procedure and attempt to calm the cat with environmental changes. Answer A. Administer pre-anesthetic sedatives to calm the cat and stabilize its heart rate. Explanation: in this scenario, the cat's elevated heart rate and signs of anxiety should not be ignored as they could pose risks during anesthesia. Administering pre-anesthetic sedatives is common and safe practice that helps calm the animal and reduce the stress response, stabilizing its heart rate and improving its tolerance to anesthesia. This approach is beneficial for minimizing the risk of complications during induction and maintenance of anesthesia. Option B is incorrect because proceeding without addressing anxiety could result in cardiovascular instability, increasing the risk of complications during the procedure. Option C is unnecessary unless the cat shows other signs of underlying cardiac disease that require further evaluation. Option D might help reduce stress, but is less likely to be effective in stabilizing the cat's heart rate in the short term. Question 13. Postoperative care and complications. Which of the following is the most critical factor in preventing postoperative wound dehiscence in an obese dog after abdominal surgery? A. Ensuring the dog receives a high-protein diet postoperatively. B. Strict restriction of physical activity to avoid stress on the incision. C. Applying an adhesive wound closure system to keep the incision sealed. D. Administering corticosteroids to reduce inflammation at the surgical site. Answer: B. Strict restriction of physical activity to avoid stress on the incision. Explanation: obesity is a significant risk factor for postoperative complications, particularly wound dehiscence, due to increased tension on the incision site and slower healing times. Restricting physical activity is critical to prevent the dog from engaging in behaviors such as jumping, running, or excessive movement that could put stress on the incision, causing the wound reopen. Option is important for general recovery, but it doesn't directly prevent wound dehiscence. Option C may be helpful in some cases, but is not a guaranteed method for preventing wound complications. Option D, corticosteroids, can impair wound healing and should generally be avoided in the postoperative period unless absolutely necessary. Question 14. Emergency and trauma surgery. A horse involved in a traumatic accident presents with severe blood loss, pale mucous membranes, and signs of shock. Which of the following is the most important immediate intervention for this patient? A. Administer intravenous fluids and blood products to restore circulating volume. B. Immediately perform abdominal exploratory surgery to assess internal injuries. C. Apply a tourniquet to the affected limb to stop bleeding. D. Place the horse in a quiet, low-stress environment and observe for further signs of shock. Answer A. Administer intravenous fluids and blood products to restore circulating volume. Explanation. In cases of traumatic shock and severe blood loss, the first priority is to restore circulating blood volume to prevent organ failure and improve perfusion. Intravenous fluids, such as crystalloids and blood products, should be administered promptly to counteract hypovolemia and address the patient's hemodynamic instability. This intervention is essential before further diagnostic procedures or surgery can be safely performed. Option B, while potentially necessary later, should not be performed immediately in the face of shock without first stabilizing the patient's circulatory status. Option C is not recommended for trauma unless bleeding cannot be controlled with direct pressure or other means. Option D, while helpful for minimizing stress, is inadequate in addressing the immediate life-threatening circulatory shock. Question 15. Surgical pathology. Which of the following is the most accurate statement regarding the role of histopathological examination in surgical oncology? A histopathological examination is only useful for confirming the presence of a tumor and does not provide additional information about prognosis. B. Histopathology can identify tumor margins and differentiate benign from malignant tumors, providing crucial prognostic information. C. Histopathology is used primarily for post-mortem analysis and has little value in the preoperative or post-operative setting. D. Histopathology can only be used to determine the type of cancer but cannot assess its stage or metastases. Answer. B. Histopathology can identify tumor margins and differentiate benign from malignant tumors, providing crucial prognostic information. Explanation. Histopathological examination plays a crucial role in surgical oncology, both for confirming the diagnosis and determining the malignancy of the tumor. It allows the surgeon to assess the tumor's grade, differentiation, and margin status, which are all important for guiding treatment decisions and assessing the prognosis. Positive margins, where tumor cells are found at the edge of the excised tissue, can indicate the need for further surgery or adjuvant therapy. Option is incorrect because histopathology provides much more than just diagnosis. It also helps in assessing tumor characteristics and potential outcomes. Option C is incorrect because histopathology is routinely used both preoperatively and postoperatively to guide decisions. Option D is partially correct in that histopathology assesses the type of tumor but is not directly used to assess the stage or metastases, which often requires additional imaging techniques. Question 16. Surgical procedures. Neurological surgery. Which of the following is the most appropriate surgical approach for addressing a herniated disc in a dog that is showing neurological deficits such as paresis and loss of deep pain perception? A. Laminectomy, followed by removal of the disc material compressing the spinal cord. B. Spinal fusion to stabilize the vertebral column. C. Posterior cervical decompression to relieve pressure from the herniated disc. D. Hemilaminectomy with dorsal approach to remove the disc material and alleviate pressure on the spinal cord. Answer. D. Hemilaminectomy with dorsal approach to remove the disc material and alleviate pressure on the spinal cord. Explanation. In cases of disc herniation causing significant neurological deficits, the most commonly used surgical approach is a hemilaminectomy, which involves removing part of the vertebral lamina to access the herniated disc material. This procedure provides direct access to the disc material, allowing it to be removed, which relieves the pressure on the spinal cord and improves the patient's neurological function. Dorsal approach is often used in thoracolumbar disc disease as it allows for direct decompression of the spinal cord. Option A, laminectomy, is an alternative, but less commonly used technique compared to hemilaminectomy. Option B, spinal fusion, is typically reserved for cases of instability or fractures rather than disc herniation. Option C, posterior cervical decompression, is generally not the primary procedure for thoracolumbar disc herniation. Question 17. Anesthesia and analgesia. Which of the following is the primary benefit of using multimodal analgesia approach in a patient undergoing surgery? A. It allows for the use of higher doses of opioids, reducing the risk of complications. B. It combines different drugs or techniques to target various pain pathways, improving pain relief with fewer side effects. C. It eliminates the need for postoperative pain management, as the surgical site will be completely anesthetized. D. It decreases the need for pre-anesthetic assessments, as pain management is guaranteed. Answer. B. It combines different drugs or techniques to target various pain pathways, improving pain relief with fewer side effects. Explanation. Multimodal analgesia involves using multiple drugs or techniques that act on different pain pathways, e.g., opioids, local anesthetics, NSAIDs, and nerve blocks. This approach is beneficial because it provides superior pain relief while minimizing the side effects associated with high doses of a single drug. For example, combining opioids with local anesthetics can provide effective pain management while reducing the risk of opioid-related side effects like sedation or respiratory depression. Option is incorrect because multimodal analgesia is not about using higher doses of opioids, but about using low doses of multiple agents. Option C is incorrect because while multimodal analgesia improves pain control, it does not eliminate the need for ongoing postoperative pain management. Option D is incorrect because a thorough pre-anesthetic assessment is still essential to ensure the patient is suitable for surgery. Question 18. Postoperative care and complications. A 7-year-old Labrador Retriever has undergone orthopedic surgery to repair a fractured femur. On the third postoperative day, the dog is exhibiting signs of fever, a rapid heart rate, and purulent discharge from the surgical site. What should be the next step in management? Apply a warm compress to the wound and continue monitoring the dog for further signs of infection. B. Start intravenous antibiotics immediately and perform a wound debridement to remove necrotic tissue. C. Increase the dog's oral food intake to boost its immune response. D. Administer corticosteroids to reduce inflammation at the surgical site. Correct answer. B. Start intravenous antibiotics immediately and perform a wound debridement to remove necrotic tissue. Explanation. The signs of fever, rapid heart rate, and purulent discharge from the surgical site suggest a postoperative infection. Immediate intervention is required to manage the infection and prevent systemic sepsis. Intravenous antibiotics should be initiated promptly to treat the infection, and a wound debridement should be performed to remove any necrotic tissue and reduce the bacterial load. This step is critical in preventing the infection from spreading or becoming chronic. Option A, while monitoring the wound is important, does not address the immediate need for antibiotic therapy and wound care. Option C is not relevant in managing infection and does not address the underlying issue. Option D, corticosteroids would impair immune function and could worsen the infection, so it should be avoided in this case. Question 19. Diagnostic imaging and surgical planning. Which diagnostic imaging technique is considered the most effective for preoperative planning when assessing soft tissue tumors in dogs, particularly for evaluating the involvement of surrounding structures and determining surgical margins? A. Computed tomography (CT) scan for detailed cross-sectional images of soft tissues. B. Radiography X-ray for basic identification of calcification and bone involvement. C. Ultrasound for real-time imaging of the tumor and surrounding vasculature. D. Magnetic resonance imaging (MRI) for high-resolution imaging of soft tissue and assessment of tumor involvement in adjacent structures. Answer. D. Magnetic resonance imaging (MRI) for high-resolution imaging of soft tissue and assessment of tumor involvement in adjacent structures. Explanation. MRI is the gold standard for assessing soft tissue tumors in dogs, particularly in evaluating the extent of the tumor and its involvement with surrounding structures such as muscles, nerves, and blood vessels. It provides high-resolution, detailed images of soft tissues and is critical. Preoperative planning, helping to define tumor margins and the feasibility of complete excision. Option A. CT scans are more commonly used for evaluating bone structures but are less effective for soft tissue tumors compared to MRI. Option B. Radiography is not ideal for soft tissue tumors and can only provide limited information regarding calcification or bony involvement. Option C. Ultrasound is useful for real-time evaluation of tumor characteristics but does not provide the same level of detail as MRI when assessing adjacent tissue involvement. Question 20. Emergency and trauma surgery. A cat presents with a deep laceration over its abdomen after being hit by a car. The wound has exposed abdominal organs and the cat is in shock. Which of the following is the first priority in managing this traumatic injury? A. Debridement of the wound and repair of the abdominal organs. B. Administering intravenous fluids to stabilize the cat's circulatory status. C. Performing laparotomy to assess internal organ damage. D. Applying temporary bandage to control bleeding and prevent further contamination. Answer. B. Administering intravenous fluids to stabilize the cat's circulatory status. Explanation. In cases of trauma, especially with significant hemorrhage and shock, the first priority is to stabilize the patient's circulatory system by administering intravenous fluids, e.g., crystalloids and blood products, to restore circulating volume and improve perfusion. This intervention is critical for stabilizing the cat before proceeding further diagnostics or surgery. Option A. Debridement should only occur after the cat is stabilized and its hemodynamic status is improved. Option C. Performing laparotomy is necessary but should be done after fluid resuscitation to avoid further compromise in the patient's circulation. Option D is an initial step in wound management, but it should not be prioritized over stabilizing the animal's circulatory system. Question 21. Surgical procedures. Soft tissue surgery. A 3-year-old boxer undergoes surgery to remove a benign soft tissue tumor located on the subcutaneous layer of the thoracic wall. After excision, there is minimal bleeding, but the wound edges show signs of tissue necrosis. Which of the following factors is most likely contributing to the necrosis of the tissue at the surgical site? A. Overly aggressive use of cautery during tumor removal, leading to thermal injury. B. Infection due to improper aseptic technique during surgery. C. Use of too much suture material, causing excessive tension on the wound edges. D. Poor blood supply to the tissue due to insufficient dissection of the surgical site. Answer A. Overly aggressive use of cautery during tumor removal, leading to thermal injury. Explanation. Thermal injury from excessive use of electrocautery can cause tissue necrosis, especially when applied too aggressively during the excision of tumors. While cautery is used to control bleeding, it must be used with caution to avoid excessive heat that could lead to ischemia and necrosis of surrounding tissues. This is particularly concerning in areas where already reduced blood flow due to the tumor or surrounding tissue manipulation. Option B. Infection is unlikely to cause immediate necrosis postoperatively unless there are signs of delayed infection. Option C. Excessive suture material could cause tension and delayed wound healing, but it would not cause immediate necrosis. Option D. Poor blood supply due to insufficient dissection could also compromise healing but does not directly explain necrosis caused by cautery. Question 22. Emergency and trauma surgery. A golden retriever presents with a massive open fracture of the femur and is in shock after being struck by a vehicle. What is the immediate next step in treatment? A. Apply a splint to stabilize the femur and reduce movement. B. Perform a full radiographic assessment to evaluate fracture complexity. C. Administer intravenous fluids and pain management before performing any further procedures. D. Stabilize the fracture surgically using a pin or plate to immobilize the bone. Answer C. Administer intravenous fluids and pain management before performing any further procedures. Explanation. In a trauma case involving an open fracture and shock, the priority is to stabilize the patient before proceeding with any definitive treatment. Administering intravenous fluids, e.g. crystalloid and possibly blood products, is essential to restore circulating volume and improve perfusion. Pain management is also critical to prevent further stress and trauma to the animal. Option A. Applying a splint may be helpful but is not the priority over fluid resuscitation and stabilization in a shocked animal. Option B. Performing radiographs is necessary but should be done after the patient is stabilized. Option D. Surgical stabilization is important but cannot be performed effectively unless the patient is hemodynamically stable. Question 23. Postoperative care and complications. A 5-year-old cat has undergone surgery for a soft tissue mass removal from the abdominal cavity. On the second postoperative day, the cat shows signs of anorexia, vomiting, and a low-grade fever. What is the most likely cause of these clinical signs, and what is the first course of action? A. Postoperative infection. Initiate broad-spectrum antibiotics and perform wound culture. B. Inflammatory response to the surgery. Monitor the cat and provide supportive care. C. Gastrointestinal upset due to the anesthesia. Start an antiemetic and encourage food intake. D. Dehydration from inadequate fluid intake. Administer fluids and encourage oral rehydration. Answer A. Postoperative infection. Initiate broad-spectrum antibiotics and perform wound culture. Explanation. The signs of fever, anorexia, and vomiting, particularly in the context of recent abdominal surgery, raise concerns about a postoperative infection. The presence of a fever is a classic indicator of infection, and the gastrointestinal symptoms may be secondary to systemic infection or the stress of surgery. The first course of action is initiate broad-spectrum antibiotics to address potential infection and perform a wound culture to identify the specific pathogen. Option B is less likely given the clinical presentation of fever and vomiting, which suggest infection rather than a simple inflammatory response. Option C. Gastrointestinal upset from anesthesia could cause nausea, but it does not explain the fever or other systemic signs of infection. Option D. Dehydration could be a concern in any postoperative patient, but does not fully explain the systemic signs of infection. Question 24. Anesthesia and analgesia. A 2-year-old Dachshund is undergoing a dental extraction under general anesthesia. The veterinarian has decided to use an opioid-based analgesic in combination with local anesthesia. What is the main advantage of combining these two analgesic techniques? A. The opioid will provide longer-lasting pain relief, while local anesthesia will decrease the need for systemic drugs. B. Opioids will be less effective when combined with local anesthesia, so their use should be minimized. C. Local anesthesia will prevent the opioid from reaching the surgical site, thus reducing its effectiveness. D. The combination will allow for the use of low doses of both drugs, reducing side effects and improving pain relief. Answer D. The combination will allow for the use of lower doses of both drugs, reducing side effects and improving pain relief. Explanation: the combination of opioids and local anesthesia provides superior pain management by targeting different pain pathways. The opioid works systemically to block central pain transmission, while the local anesthetic directly numbs the surgical area. This combination allows for the use of lower doses of both, which helps minimize the risk of side effects, e.g. sedation from opioids or tissue toxicity from local anesthetics, while enhancing overall pain relief. Option is incorrect because while the combination does provide excellent pain relief, it is not primarily about extending the duration of opioid effect. Option B is incorrect because opioids remain effective when combined with local anesthesia, and their use is beneficial. Option C is incorrect because local anesthesia does not prevent the opioid from reaching the surgical site. Instead, they work synergistically to provide pain relief. Question 25. Advanced surgical techniques. Which of the following is a primary advantage of using laparoscopic techniques in veterinary surgery? A. It allows for faster recovery and less postoperative pain due to smaller incisions. B. It eliminates the need for general anesthesia as the patient can be awake during the procedure. C. It provides better visibility of deeper structures in complex surgeries compared to traditional open surgery. D. It allows for the removal of large masses or tumors that would be difficult to excise with traditional surgery. Answer A. It allows for faster recovery and less postoperative pain due to smaller incisions. Explanation: laparoscopic surgery involves making small incisions through which specialized instruments and a camera are inserted to perform surgery. The primary benefit of this technique is that it results in smaller incisions, which minimizes tissue trauma, reduces postoperative pain, and leads to faster recovery times compared to traditional open surgery. Smaller wounds also generally reduce the risk of infection. Option B is incorrect because laparoscopic surgery still requires general anesthesia, as the procedure requires the patient to be in a stable, controlled environment. Option C is incorrect because while laparoscopy provides enhanced visualization in some surgeries, it is not necessarily superior to traditional open surgery for all procedures. Option D is incorrect because laparoscopic techniques are more suited for minimally invasive procedures, and larger masses or tumors may require open surgery for complete excision. Question 26. Surgical procedures. Orthopedic surgery. A 7-year-old Labrador Retriever presents with a displaced tibial fracture after a vehicular accident. The fracture is unstable and requires surgical intervention. The surgeon opts for an intramedullary pinning technique with cerclage wire. What is the primary goal of using cerclage wire in this procedure? A. To prevent infection at the fracture site. B. To align the bone fragments and hold them in place during healing. C. To reduce postoperative pain and inflammation. D. To promote bone regeneration through electrical stimulation. Answer: B. To align the bone fragments and hold them in place during healing. Explanation: cerclage wire is used in orthopedic surgery to hold the bone fragments together in cases of displaced fractures. It is typically applied in conjunction with an intramedullary pin to stabilize the fracture and maintain proper alignment while the bone heals. The wire helps to prevent further displacement of the fracture fragments, ensuring proper bone union. Option A, preventing infection, is not the primary purpose of cerclage wire. Infection prevention is managed through aseptic techniques and appropriate antibiotic use. Option C, reducing pain and inflammation, is not a direct function of cerclage wire, although it may indirectly help by stabilizing the fracture. Option D, promoting bone regeneration, is not the function of cerclage wire, which is aimed at stabilization rather than stimulation of bone growth. Question 27. Anesthesia and analgesia. Pain management. A 5-year-old cat has undergone a routine space surgery. The anesthetic protocol involved the use of propofol for induction and sevoflurane for maintenance, along with opioid analgesics for pain control. Postoperatively, the cat remains quiet and lethargic but is not showing signs of pain. What is the most likely explanation for the cat's postoperative lethargy? A. The cat is experiencing postoperative pain despite the analgesics. B. The opioids administered during surgery are causing prolonged sedation. C. The anesthesia protocol used was too light, resulting in inadequate sedation. D. The cat is experiencing an allergic reaction to the opioid administered. Answer. B. The opioids administered during surgery are causing prolonged sedation. Explanation. Opioid analgesics can cause sedation as a side effect, and this may persist for some time after surgery. Although the cat is not showing signs of pain, it may still experience residual sedation from the opioids given during the procedure. This is the common effect in animals undergoing surgeries that involve opioid administration for pain management. Option is incorrect because the cat is not showing signs of pain, such as vocalizing or restlessness. Option C is incorrect because the anesthetic protocol involving propofol for induction and sevoflurane for maintenance is appropriate for routine space surgeries. Option D is unlikely because allergic reactions to opioids are rare and the lethargy is more likely related to the sedative effects of the drug. Question 28. Postoperative care and complications. Wound infection. A 3-year-old beagle undergoes surgery to remove a foreign body from the stomach. On the third postoperative day, the wound site appears red, warm to the touch, and is leaking a small amount of purulent discharge. The dog is also febrile and shows decreased appetite. What is the most appropriate next step in management? A. Apply a warm compress to the wound to promote drainage. B. Administer intravenous antibiotics and perform wound culture. C. Remove the sutures to allow the wound to drain naturally. D. Monitor the wound and provide supportive care for another 24 hours. Answer. B. Administer intravenous antibiotics and perform wound culture. Explanation. The clinical signs of fever, purulent discharge, and localized warmth are indicative of a wound infection, which can occur postoperatively, especially in cases involving the gastrointestinal tract. The most appropriate next step is to administer intravenous antibiotics to address the infection and perform a wound culture to identify the pathogen and treatment. Option A. Applying a warm compress may help with drainage but does not address the underlying infection and should not be the primary intervention. Option C. Removing the sutures is not recommended without the guidance of a veterinarian, as it may lead to further complications. Option D. Monitoring the wound and waiting could allow the infection to worsen and does not adequately address the infection. Question 29. Surgical procedures. Neurological surgery. A 4-year-old German Shepherd presents with progressive hind limb weakness and ataxia. After diagnostic imaging, the veterinarian diagnoses a herniated intervertebral disc at the LL level. Which of the following surgical approaches is most appropriate for addressing this condition? A. Dorsal laminectomy to remove the herniated disc material and relieve pressure on the spinal cord. B. Ventral cervical fusion to stabilize the cervical spine and prevent further herniation. C. Hemilaminectomy with decompression of the affected disc space. D. Lateral thoracic intercostal nerve block to control pain and inflammation. Answer. A. Dorsal laminectomy to remove the herniated disc material and relieve pressure on the spinal cord. Explanation. A herniated intervertebral disc at the LL level could compress the spinal cord, leading to neurological deficits such as hind limb weakness and ataxia. The most common surgical intervention for this condition is the dorsal laminectomy, where the dorsal portion of the vertebra is removed to access the herniated disc material and relieve pressure on the spinal cord. This procedure helps to prevent further neurological damage and promotes recovery. Option B. Ventral cervical fusion is used for cervical disc disease and is not appropriate for the thoracolumbar herniated disc. Option C. Hemilaminectomy is another option for intervertebral disc disease, but the dorsal laminectomy is typically preferred for thoracolumbar herniations. Option D. Lateral thoracic intercostal nerve block is a pain management technique and does not address the herniated disc itself. Question 30. Surgical pathology. Cancer diagnosis and staging. A 9-year-old Rottweiler is diagnosed with a malignant soft tissue sarcoma in the right hind limb. The tumor has been excised and histopathological examination confirms malignancy. The next step in the management of this patient should include which of the following? A. Chemotherapy to address any microscopic residual disease and reduce the risk of metastases. B. Radiotherapy to shrink any remaining tumor cells in the surgical bed. C. Lymph node biopsy to assess potential metastases. D. Immediate amputation of the affected limb to prevent further tumor spread. Answer: C. Lymph node biopsy to assess potential metastases. Explanation: in the case of a malignant soft tissue sarcoma, one of the most important next steps after surgical excision is to assess for metastases, especially to regional lymph nodes. A lymph node biopsy is necessary to determine if the cancer has spread, which will influence further treatment decisions. If metastases is detected, chemotherapy or radiotherapy may be considered. Option A. Chemotherapy may be considered if metastases is detected, but it is not the first step immediately following surgery. Option B. Radiotherapy is generally used to treat residual tumor cells after surgery, but is not the first step in assessing metastases. Option D. Amputation is not warranted unless the tumor is located in a limb that is difficult to preserve and it would not address the need for metastases evaluation.